you so much. Thank you for having me. My name is Jenna Thomas, and I am the Advocacy Director at Bike Cleveland. We are an advocacy and education nonprofit focused on safer streets and better transportation for all Clevelanders. And so today I'm going to share some things that we are working on, some of our priorities, some data and resources, and yeah, glad to be here. So to start with some programs that we run, our Better Street Committees are groups of residents all throughout the city of Cleveland that come together typically once a month, almost like a block club, that focuses on specifically improving bikeability, pedestrian safety, overall street safety, access, connectivity, building community. And we have 10 of those committees across the city, and they are passionate about local changes that make their streets safer. Some of these activities that they do, they typically meet monthly, hosting things like neighborhood walks and walk audits, bike rides, film fests or movie nights, street painting, and things like that. We also run a yearly transportation academy. This brings together a cohort of residents to learn about the process and decision-making behind what makes our streets look the way they do, and just generally build the knowledge base of residents to be able to advocate for the changes they want to see and better understand the systems that inform our street design. Youth education. My colleague Diana Hildebrand, Miss Diva D, is an amazing educator, educating hundreds of youth throughout the city, hosting youth camps, learn rides, and all around just really making a really great impact on all of the kids in the city of Cleveland, working closely with CMSD, and now also training physical education teachers on how to do bike education, so we can kind of increase our ability to provide this kind of education to Cleveland kids. And then we publish a yearly crash report looking specifically at all of the bicyclist and pedestrian crashes that happen in the city of Cleveland. Still currently working on the 2025 report. I'm going to highlight some of the things that I'm finding. And once this is published, sometime in the next month, I think it'll be a helpful resource for you to better understand where the crashes are happening in your ward, things that can help mitigate those. We dig deep into traffic enforcement and challenges with the traffic data that we have and all of those impacts. So I'm going to highlight some of those things today, but I am excited to publish this and share this with you all sometime in the next month. Okay, so our philosophy is that the health of Clevelanders depends on a transportation system where everyone can get where they need to go without being seriously injured or killed, and that everyone can access their needs. So starting with that first bit, this is a compilation of actual footage of crashes happening in the city. All of these happened in the last year or two. These are people that are crossing the street, just biking on the road, I review a lot of this footage, and it's really, it really helps put into perspective that these are real people. They're just crossing the street or riding down the street, and there's a lot of careless driving, reckless driving, and also our streets are really designed in a way that facilitates this kind of driving, and there are design choices that we can make to mitigate these things. And I'm going to also highlight a couple specific stories. These are all stories that I collected from people that were hit in 2025. So I'm just going to read some of their testimony. So this is a 74-year-old Cleveland resident who is remaining anonymous because he has, this is an ongoing case, but in November of last year, I was hit while crossing the street on Lorraine. The driver was turning left and hit me. I had a fractured tibia, 9 broken ribs, was taken to Fairview Hospital right away. I was in the hospital for 3 weeks, followed by another month in rehab. This is something I had never experienced. It was all new, and I had to go through hell to get the authorizations I needed to get care across different hospital systems. I'm still recovering. The driver was ticketed $236. This is from Jeremiah, a 19-year-old Cleveland resident. I was crossing the street at East 105 in St. Clair with a few seconds left, so I sprinted to try to make it. I was halfway across the street when a driver turning left hit me. I flew off the hood of the car and landed around 20 feet from where I was. The driver took off while a bystander called 911. I had a torn ACL and cuts to my torso. I got through reconstruction surgery, and I'll still be in a brace for another 9 to 12 months. A couple days later, I called the police to make a report. The EMS that responded had given me a sheet of paper with the license plate number written on it, but the paper got lost somehow with everything that was happening. Another time, a driver almost hit a group of friends while we were walking down the street. We screamed before he could hit us, but it was a close call. I didn't think much about this or notice how people drove until those 2 incidents. I think about it now, and it stuck with me. And lastly, Andrew, an 81-year-old resident. On March 9th, I was headed back from the local dollar store at Pearl and Broadview. I live in senior housing nearby, and a lot of seniors in the area are pedestrians and frequent this dollar store. I was crossing Pearl with the walk signal and in the crosswalk when a driver turning left hit me. The driver gets out, yells at me to get up, and eventually leaves while bystanders offer support. I was taken to the hospital and treated for 10 broken bones, among other injuries. I spent nearly a month in a rehab center. Although the crash was on camera and the driver was uninsured, there were no tickets or charges, and I have to pursue this in civil court. Since that crash, I've changed where I cross the street to avoid this intersection, and have advised others in my building to do the same. There are a lot of dangerous intersections in the neighborhood, like Pearl and State 2, and there is a lot of pedestrian traffic. So when I talk to people, they frequently are describing their injuries, what their recovery looked like, how life-altering these things can be, the kind of justice part of it. In this case, there was no ticket. He pursued this in civil court. In this case, it was a hit and run, but it seems like maybe they had the license plate information, but it somehow was never recorded. And then in this case, there was a $236 ticket for these, fractured tibia, 9 broken bones, etc. So, these are the things people tell me about when I talk to them. There was more than 500 people hit on our city streets in 2025. This is down from 2024, which was a little over 600. But it's still an unacceptable number, and a lot of these are very preventable through simple design changes. And then so far this year in 2026, we've lost 18 of our neighbors to traffic crashes. Yeah. So, wanted to highlight some policies that we've been researching that we think could help mitigate some of these issues. I think a lot of these things are things that you've heard of before, and that can be done on kind of one-off instances. But there are also many cities that have actual policies to kind of systematize these and make them more standard. So the first of those being side guards. If there's a crash between a truck and a bicyclist or pedestrian, these can be extremely dangerous and serious because they can be pulled under the truck. And so these side guards, which 10 of our fleet trucks have, prevent this from happening. But there are cities that require these for all large trucks, but also all large trucks of people that contract and do city business with the city. And so with all of these, following this presentation, I have some good example legislation and even some drafted legislation for a few of these to help give you an idea of how other cities have done this. Leading pedestrian intervals, also called a head start. So these are a simple signaling change that gives pedestrians the walk signal before anyone gets the green light. Intersections are really where a lot of these crashes happen. And so anything that we can do at these intersections to improve safety of pedestrians and people on bikes is can really prevent these things. This is a simple intervention that only requires changing the signals. No red on red. This is also a very common kind of contributing instances of a crash, and reducing those right turn conflicts can be really helpful, especially around schools, rec centers, parks, places with high pedestrian traffic. Speed is really the #1 factor that will determine whether someone survives being hit by a driver. And we know that the state makes it very hard to change speed limits, but we have some local examples of cities being able to, control their own streets and the speed limits. So Cleveland Heights, for example, passed a policy that reclassified some streets as non-through streets. Basically, the state code says that if it's a through street or a through highway, it must be 35, but you can simply reclassify this through legislation. In fact, in like 1996, I don't have the exact year here, Cleveland's code actually identified some streets as through streets, mandating them to be 35 miles per hour. So within the code, there's already streets outlined as through streets that weren't already classified that way. So it could be as simple as removing those classifications as a start. Another priority of ours is seeing an increase of staff capacity at City Hall. Doing all of these things is limited by a very small transportation staff, mobility staff in the city. Right now, we are over-reliant on expensive consultants, and in-house engineering staff could help design really small changes to the street, like curb extensions, process turning movements, analyze data to determine where things like centerline hardening will go. This kind of engineering support staff that other cities have can really make some of these smaller changes move faster. And an in-house installation crew can also help quickly deploy those installations. So in the city of Cincinnati, they passed legislation to create a 5-person pedestrian safety crew, is what they call them. And their sole task is to install the simple improvements like centerline hardening, curb extensions, upgrading bike lanes to have our existing bike lanes to have separation. Right now, of course, these tasks are split between different crews in the city that are focused on resurfacing and things like that. And so creating a small crew focused solely on this can really help deploy these installations faster. And we believe that increasing in-house staff in both of these areas would really save the city a lot of money that right now it spends on contractors and consultants. And then creating a Department of Transportation. This is something that more and more cities are moving towards, including Pittsburgh in 2017, Atlanta in 2019, Nashville in 2021, and Louisville in 2024, all established new departments of transportation to streamline the things that right now are split between several departments in our city hall. It makes it more difficult to deploy these things, access funds, when it's all split between different departments. And I think in the meantime, it would be useful for those departments to kind of report back to this council on the progress on especially the commitments the city has made in terms of Vision Zero and Cleveland Moves, to establish what progress is being made. We all love traffic calming. The city has established a really great speed table program, but there are many more tools at our disposal, and the city could use a more strategic and sustainable approach to installing those traffic calming measures. I wanted to share a couple case studies of successes in the city of Cleveland that we know work. So first is the Franklin Boulevard mini roundabouts. Before the safety project, this is a mostly residential street that before was just a bunch of, a handful of lights, 2 lanes with some parking, and it was frequently used as a cut through. So they're the daily cars was around 2,272. 8% of cars were going over 35 miles per hour, and there were 40 crashes in 2021. Since this was installed, that average daily traffic has been cut in half, which I'm sure many residents on that street are pleased about. That drivers are now choosing to take one of the main roads instead of their residential street. 1% of cars are going over 35 miles per hour, and in 2024 there were only 4 crashes, down from 40 in 2021. So if you travel on the street, I'm sure you've noticed how different it feels. And this is, I think people weren't sure about the mini roundabouts. Totally new, kind of, design to the city. People think about, like the Steelyard roundabout that is really massive and kind of confusing. But these are really meant for, when there are wider residential streets that are frequently used as cut-throughs that people are speeding on, this really forces you to slow down. They've designed these in a way that makes it super accessible to trucks still. You can easily mount, they're mountable, you can easily drive over them. And I know that when I bike, I live over in Jefferson, and I frequently choose Franklin over any other street. Another good example is in Waterloo Arts District. So in 2020, starting in 2020, residents and merchants around Waterloo began advocating for traffic calming. And in 2022, the Collinwood Better Streets Committee was formed. And in just one day, city traffic counters found over 2,000 cars speeding through this section of Waterloo between 156th and like 163. 2,000 cars speeding in just a quarter-mile stretch, including one that got sent into 6 Judah Coffee. I'm sure many of us have seen this happen in your own ward, where a car ends up in a storefront. So residents and businesses rallied for traffic calming. Speed tables were installed. And then at the intersection of 156th and Waterloo, Central Line hardening, the very first in the city, was installed. Down there, you'll see 2 left turn crashes that happened at this very intersection involving a pedestrian, where Central Line hardening would have prevented this. On that left side, you see that car is taking an extremely sharp left turn into the oncoming turn lane. This car, it's harder to see the other side, but they're doing the same. The pedestrian is about to pass that center line and be in the safe zone. But because these drivers are turning sharply, that really increases where the amount of space where a pedestrian is vulnerable. And so since these, right, 156, 163rd, yes, crashes way down. I think there was 1 in 2025, down from 9 in 2023. And then all crashes, since the Central Line hardening was installed in August 2024, there has not been a crash in that intersection, including even car-on-car crashes. So we know these things work, and this is a very simple installation, affordable, that can actually just get rid of crashes. Secondly, we would love to see a transportation system where everyone can access their needs. So this is a really helpful resource. The Cleveland Health Survey and the ward fact sheets from Center for Community Solutions compiles this and census data, and asks the question of, has unreliable transportation kept you from medical appointments, work, or getting to the things that you need in the last year? And so you can kind of see the breakdown by ward of how many residents, and then the percent of residents that have experienced this. So notably, Ward 9, nearly 39% of residents said that they were kept from these things due to unreliable transportation. And then across the whole city, over 61,000 Clevelanders expressed that transportation was keeping them from these things. And so, when I think about the health of Clevelanders, accessing medical appointments, accessing the grocery store, access to social opportunities and recreation, the lack of transportation is a really big barrier. Our census data for vehicle availability also really speaks to this. There are census tracts in the city where 50% of the residents don't have a car. But also across the city, there are many wards that over 25% of Clevelanders don't have a car. I think about seniors who maybe have aged out of driving. All young people don't drive, and so yeah, access to a vehicle is a big inhibitor. So I feel like we've all probably been in this situation where we're wondering, why would we support bike lanes? And I know that it's important to me that Bike Cleveland is not just seen as a bike advocacy organization. It is core to what we do, and we talk about it a lot, but we are interested in safer streets for all and a better transportation system, and I think that includes bike lanes. So if you're wondering, why should I support bike lanes? I think we underestimate how great of a tool for transportation the bicycle is. People around the city are already using this to get around. I encourage you to definitely take note as you travel around how frequently you will see people biking that are not out, just getting a ride in for exercise. They're going somewhere, and it is incredibly affordable. As we know that owning a car is getting more and more unaffordable. The bicycle is a fantastic, affordable option for getting around. I think a lot about how it really enhances access to public transportation. So if you, like for me, I live about a 30-minute walk from the West Park Rapid Station, but that's a 5-minute bike ride. And so if I have a safe route to that rapid station, it makes it all the more reasonable for me to be able to choose public transportation as my form of transportation. And many households in the city of Cleveland, if they have a car, the vast majority are sharing one car. And so when someone is making the calculation of do we have to get a second car because we have several people in our household that need to get places. When we build infrastructure that actually allows people to make a decision, that they're not forced into spending massive amounts of their income every month on owning a car, that can free up thousands of dollars a year to spend on other things. And I think a lot about the dignity of transportation, and when these are all streets in the city of Cleveland, and when our streets look like this, I think it shows that for many, many years we were designing streets just for cars. We were just interested in moving cars quickly and being, not considering people that are walking and biking in our neighborhoods. And so I think that there has then been a lot of, shame put on people that can't afford a car, and that bike and walk and take transit, because when they go out, they're competing with this infrastructure that really facilitates speeding and reckless driving. And fortunately, because our streets look like this, that means that we have the capacity to improve them. We're overbuilt in a lot of places, and so that means there's room for other things, whether that's expanded sidewalks, off-street trails, bike lanes, separated bike lanes. And I'll leave you with this that I think really resonates with me. When engineers specifically talk about the capacity of the street, they're talking about that image on the left, cars, 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 cars. I think when we all think about a capacity of the street, we're thinking about a lot of other things. The capacity for small businesses to thrive, the capacity for young children to be able to access the parks and schools and rec centers and other destinations. We're thinking about, how safe people feel in their homes if people are speeding down their street. And so, I think as we talk to people about the capacity of a street, that image on the right of all the things is something I think about a lot. And so that's it for me.
Thank you. Mr. Chair, you want to? Thank you, Jenna, for this presentation, and thank you for driving home the
point that pedestrian and bicycle safety is a health issue, that there are hundreds of people who are injured every year. Part of what's got me all fired up this year was, of course, the death of Beverly Jones at 58th in Lorraine hit by two cars, not one but two. The second one didn't stop and kept going. And then more recently, Myron Lashley on 14th near Abbey, hit from behind at 10:45 in the evening on a scooter. Guy drove away. We haven't caught the person who killed this individual in my community. So it's, the blood on the street is really fresh in my mind's eye. What would you suggest we do first?
Yeah, so following this, I have several resources I can share with you, including draft legislation for a couple of the policies I mentioned, including lowering speed limits and creating a better system for installing leading pedestrian intervals, as well as a few other draft legislations from other cities for the side guards, for establishing an installation crew. I'd be happy to share all of those things with you. And I think, working with us and then with your staff to figure out how this fits in the city of Cleveland, I think legislation can really get us a long way.
Okay, I love that. And let me even go to a different point, too, because you mentioned that the city has made commitments and we should be checking in on what those are. Could you give us a sense of what the commitments that the city has made that are on your mind?
Absolutely, thank you. So in 2022, we passed the Vision Zero Action Plan, which established the goal of eliminating all traffic fatalities and serious injuries by 2032. We have seen a decrease between 2024 and 2025 in pedestrian fatalities, or all fatalities. But so far this year, it's not looking necessarily like that's going to be a consistent trend downward. So I think just the deployment of those simple traffic calming measures that have proven to eliminate crashes is something that would be wonderful. The city is working really hard. I know staff in City Hall are working very hard to access the grant funds that are available to us to install better projects so that it's not just we're putting the street back exactly how it looked before. And then the other commitment was in Cleveland Moves to build 50 miles of low-stress bike facilities in 3 years, which would put us in April of 2028. This first year since Cleveland Moves was passed was a lot of grant applications and securing a lot of great funding for the city. But the deployment of that infrastructure has been, we've not yet figured out how to do that quickly and efficiently. So especially when I think about our existing bike infrastructure, our existing bike lanes, which we have many of, but many of them are 8 feet wide. People driving them, people parking them. If we're going to have a bike lane, it should be functional. And so, deploying separation to those existing bike facilities, I think prioritizing, figuring out how to do that quickly would go a long way to reaching that 50-mile goal.
Makes a lot of sense. Yeah, I appreciate, let's not do things halfway. Let's just do them right. Maybe my last question is, and this is a quick story, is I sat down with a member of your team and watched some of those videos that you had stills of folks who were hit by cars, and disturbing on any level, but what troubled me was the differential between official statistics about when a crash actually occurred and what you and your team through public records had found were, no, there's far more crashes, there's video of these crashes, we know that's a crash, it just wasn't classified or coded in the official data as a crash. Can you tell us about a little why that is? Because it was alarming to see, one more time, people being hit by cars and our stats not catching that.
Yeah. So through our crash report work, what we do is we compile the formal OH1 crash reports, which I'm sure you've all looked at before. These are the formal police reports that are submitted to the state. And in addition to those, we are also requesting 911 calls and dispatch data, because in our city we have a code for pedestrian struck, which encompasses bikes, pedestrians, wheelchair users, scooters. And so we're able to pull all of the calls coded in that way. And then we're able to compare how many times someone called 911 to report something, and then how many times an actual formal report was created. And it's about 50% of crashes don't ever receive a formal crash report. And then we go a step further when we're able to collect the videos, even 911 calls now to get a really complete picture of what's happening. And through that, we are uncovering all sorts of things that I would be happy to talk to you all or in safety committee about in the future, including just a lack of enforcement. Even when a driver stays on scene and is labeled at fault, they have about a 2 in 3 chance of not getting a ticket still. And there's also a very high number of hit skips, people fleeing the scene that are, maybe not fully investigated and then just, never fully solved. And so why we're missing crashes? A variety of reasons, potentially. Something that I'm seeing very, very frequently is EMS shows up first and transports the victim before police are able to arrive on scene. And so by the time an officer arrives, especially if it's a hit skip and then the victim is gone and it's hard to reach them in the hospital system, sometimes those crashes just totally disappear. Sometimes all people leave the scene. The victim too might not want to stick around. I know when I've talked to people that have been hit and didn't stay on scene, they're just like, I just wanted to get out of there. Like I didn't know what was going to happen next. Sometimes it's one of our private police departments in the city are responding, and the communication between like Case Western PD, RTA PD, and the city. Sometimes those don't receive a formal report. Those are some of the reasons that our data is flawed.
Wow. So there's seems like a long list, but ultimately 50% of crashes don't have a crash report.
That is right.
What
Yep.
you're indicating, right? I'll stop there.
Councilman, we could,
Mr. Councilman.
your name again?
Jenna Thomas.
Jenna? We could meet with her one-on-one.
For sure.
Take a look at the legislation that she has going on. And then maybe some of the areas that she was narrating to us, we can go get an up-close view of what's going on with it. I mean, seeing it on the slides is good or great, but probably need an up-close view
Oh, yeah.
on some of those areas. So you have Jenna's phone number, right?
Oh, yeah.
Yeah, then we can do that.
That'd be great.
I'm interested
That'd be
in doing
great.
that.
Thank you.
The part I like, really, well, I like all of it. You did a great job presenting. I like the health piece, which is very, very important. Riding your bicycle is good for you, for your health, for your legs, for the lungs, for the whole overall picture of health. I like that, all together. I know a lot of countries, they ride bicycles, and it's good for the environment as well. So I like that too. The environment, the health, having fun. It's a family activity, the whole 9 yards. I like all of it. So yeah, I'm open to talk with you one-on-one. With Austin Davis, Councilmember Austin Davis, we can do that.
That'd be great.
And that's where I'm at.
Just do it.
Oh, move the mic closer?
I know Councilman Harsh had some questions too.
Yeah, and Councilmember Joe Jones as well. Councilman?
Yeah, thank you, Mr. Chair, and thank you, Ms. Thomas, for coming in with this information. As you know, I'm a big advocate and fan of bicycles. I've been promoting their use in the city for a long time. I was at the first critical mass in the city of Cleveland when Mayor Mike White ordered his police department to arrest us. They corralled us and ticketed us for riding our bikes in downtown Cleveland. It was the craziest thing I'd ever seen. And that critical mass turned into the much better idea called Slow Roll, which I hope that everybody has a chance to go on the Slow Roll in their neighborhood, because they visit literally every single neighborhood in the city of Cleveland, and it is a truly slow roll. You don't have to be fast, you don't have to be in shape, you can just chill, enjoy your neighborhood. I do it every single year in Old Brooklyn. I try to get out to your neighborhoods as well. But bicycle culture is a wonderful way to experience the city and the earth in general. I also didn't have a car for a couple of years. So when I lived in Tremont, my bike and my RTA pass are how I got everywhere in the city. So I understand how bicycles can become a functional part of your life that really gets you where you need to go. And we want to build the environment to make that and facilitate that, so the more people can make that choice more easily.
Can I say something?
So I
Councilman?
have questions about the safety issues,
Can I
but
say
absolutely I'll yield to the chair, of course.
With these gas prices, man, you're going to see more people on bicycles. These gas prices.
Whether they say never let a crisis go to waste.
Yeah.
My questions are this. Through the chair to Ms. Thomas. The traffic calming measures that serve to support bicycle infrastructure also have some other unanticipated consequences. So I think I got a lot of calls from the people that live on the streets next to the streets that got speed bumps. So we put them on Oak Park, people on Portman started calling me. We put them on 58th, people on 57th started calling me. Because the people that don't want to drive slowly and adhere to traffic laws just went on a different street. They found a different route. So my question is, while the roundabouts on Franklin are working on Franklin, what do we know about the streets right over, about Bridge or Detroit itself? Through the chair.
If I may interrupt, Councilman Harsh, I'm actually having a community meeting tomorrow, hosted by Ohio City Inc., because we're going to be putting some roundabouts on Bridge. Would love to have you if you're curious.
Okay.
The traffic engineering department's presenting data on this exact question.
I would do my best, but probably won't make it.
I'm sorry.
No worries. To the councilman through the chair, I think I don't have all of this data, but I know the city is increasing its or its traffic counter output tremendously, and they're putting these traffic counters on all, any street you may request, and so there might already be existing data on traffic counts on the adjacent streets to where the speed tables were installed to demonstrate whether there was an increase in that. Yes.
So through the chair, I'm looking at the map that you put on our presentation on the tablet, but I don't think it was on the presentation on the.
I might have accidentally.
Did we miss it? Because I guess what I'm getting at is, are we seeing from your perspective? Oh, there it is. Yeah. Are we seeing from your analysis a decrease in the number of bike? Oh, and by the way, my friend Layla is in the hospital right now. She's 74 years old, and she was biking up in Bracknell. She's a very active lady. God bless her. And she got hit, and she's in the hospital with many, many, many problems right now. And so this is like, it touches us. Are we seeing a decrease in the number of overall bicycle injuries as we implement all of these?
To the councilman through the chair, we have seen a decrease in the number of crashes according to our full analysis of all of the data from 2024 to 2025. But we have not seen a significant decrease in deaths, serious injuries, or necessarily crashes involving bicyclists and pedestrians. Through the chair, I think that we are still a ways away from really seeing the level of infrastructure that we would need to see to see a significant decrease. But in the instances where we are measuring the before and after where traffic calming was implemented, I do think the data is very compelling.
Through the chair, the reason I ask is one of my big fears is that we're just pushing the accidents onto different streets. And that like the people will just drive more recklessly on the next street over, and we'll have the same problems over there. Another question, and I'm not trying to put you on the spot, Ms. Thomas, as like the spokesperson for all traffic issues. I know you're an advocacy organization for bicycle use, and I don't want to ask you to overstep that. But the stanchions that have been new, do we know through the chair what the average life of a stanchion is? Because I know they do get run over. Do we know like how long they typically last?
Through the chair, I am not sure. I would be interested also to know if they're kind of keeping track of those. Anecdotally, I think, for example, the central line hardening, I have seen those certainly get hit more often. I think in the case of like the curb extensions, like the ones on Franklin, do I have any? Yes, so in that top right corner, these are blocking off kind of the parking lot, parking space directly next to intersections to improve visibility and overall just narrow the street so it feels slower. Anecdotally, I have not seen these, suffer. I'm guessing these have been in for several years since these were installed and rarely get hit. I think the center line hardening, just by nature of them being in the intersection, do get hit pretty frequently. And then through the chair, also to go back to your last question about kind of the consequences of surrounding streets. I also wanted to mention that Detroit installed its 10,000th speed table 2 years ago, and
10,000 speed tables.
And so there are many, and they're saying now like we've stopped receiving requests, like all of the streets that we're seeing issues. We've addressed those, and we're able to kind of move on to other things.
Yeah.
And then I think in the case of places like Franklin Boulevard, really the alternative routes are those main streets like Detroit and Lorraine. And so I would guess that for those kind of long cut-through streets, frequently those are diverted to the main streets that are parallel.
Yeah. Through the chair, I'll look into Detroit. I'm curious what their ambulance drivers think about that. But my experience has always been when I was on a bike all the time, I wanted to be as far away from cars as possible. I didn't want to be on the side of the street. If I could get, I didn't want to be on the sidewalk either because that doesn't work. But if I could get a path, if I could get anything like a tow path or a dedicated off-road lane, then I could ease up a little and not worry about cars. And I would like to see us continue to develop that infrastructure where we've got the sort of completely separated off away from streets. But while you're on this is my last question. That roundabout on Fulton right there, through the chair, is there a reason that you're aware of, Ms. Thomas, that there's not something in the middle of that roundabout? Yeah, okay, what's going on there? I've heard different stories about this.
Yeah, through the chair, I think one of the main reasons is so that they continue to be mountable for garbage trucks, any kind of large
So that they
vehicle,
can go
school
over
buses,
them if
so you
needed.
can easily go over them.
Uh-huh.
This is kind of a selling point for these roundabouts, is they're designed in a way where you can go over them.
Uh-huh.
Perhaps there could be something in the very center that still allows that. And I also think that at the time that these were designed, people weren't sure about putting, kind of more physical upright barriers in our streets because, fixed object crashes are really, really frequent in the city.
Yeah.
But I do think that those kinds of treatments do help with the visibility of this type of thing. I think it's just figuring out a design that still allows it to be mountable for those large vehicles.
That's interesting because I was in a neighborhood in Chicago 20 years ago, and every intersection had a tree. Like they had a huge planter in the middle of the intersection. It was you could not miss it. Like it was right in front of you, and it forced a roundabout at the intersection without having to change the actual construction or engineering of the intersection. It was roughly the size of the table, and it worked for me. I had to slow down but I was told that the city of Cleveland doesn't like putting things in the middle of the intersection because of trucks and vehicular traffic, and that sounds like what you're saying as well. So, okay. Thank you. I appreciate everything y'all do for the city, and thank you for coming in this morning.
Thank you.
Yeah.
Councilmember Joe Jones.
Thank you, Mr. Chairman. Looking here, I want to just focus on, first I want to thank you for the putting together the presentation, and I was looking for the ask, so I didn't know if there was an ask at the end of this presentation.
Yes, through the chair. I'm going to be following up with a couple example pieces of legislation related to some of the policies that I highlighted. So some of these are actually drafted, like red line pieces of legislation that are ready to introduce. Some of them are examples from other cities to give you an idea to perhaps work with your staff to form legislation that I think rather than treating these kinds of treatments as one-off things that we do when we're able, making them systemic and then ensuring that they last for generations.
So your ask is to introduce 3 different pieces of legislation, and that legislation is, do you have that, are you prepared to talk about that now, or?
I could talk a bit about that, and then through the chair, I could also highlight a couple other asks.
Before we go into it, just for the sake of time, how long would that be? Because we should have probably had that be a part of your presentation.
Sure. Yes, I do apologize for not bringing those today. Through the chair, kind of in summary, there are pieces of the city code that allow for higher speed limits on some streets, and so the legislation would just remove some of those designated streets. And then in terms of signaling changes, it just establishes that anytime signaling upgrades are already being done to lights, that these leading pedestrian intervals are installed. And then I'm happy to follow up with some of the other example pieces of legislation that.
So that one is one piece, and then you have 2 other additional pieces. Can you make that, Mr. Chairman? Can that be provided to the council so that we can have a better understanding of that? And then I would just caution you because every neighborhood is different. You can see your maps here tell us that story. So then the next issue is, you know, have you brought this to the greater community, to like Ward 1? I see that you have 15 wards here that you talk about people not being able to access transportation, and you went percentages. So have you had an opportunity to talk about this in these various different respective territories?
Yes, through the chair, we recently established our Lee Better Streets Committee, which encompasses Leesville and Lee Harvard. And this committee has been meeting for a few months. There were several Ward 1 residents who were a part of our Cleveland Transportation Academy. And so from that, decided they wanted to do more resident organizing in the neighborhood. And so we are, the goal of that Lee Better Streets Committee is to, one of our first goals is to look into the Lee reconstruction project, which I know is just starting to get designed, to figure out, what kinds of safety measures could be a part of that. I know that there was a fatal crash just earlier this year, Ellie and Miles, and so yes, we're definitely interested in establishing better relationships with residents across the city.
Would certainly love to sit down with you and give you a little bit of a historical perspective. It certainly is not the place here right now at the table, but do want to just touch on some points because I know time is of essence here, and we got a couple pieces of legislation to go through. If we could turn to the map that my colleague, Mr. Chris Harsh, brought to your attention and said, hey, can you talk a little bit about it? This is where we have the rates of fatal serious injury and crashes by ward. And then I have questions I would like to ask you. You have here wards 17, 16, 13, and 12. They're all like a light tan. And then you have Ward 1, which is like a mustard color. And then you have these darker green hues. So for Ward 1 in particular, how many fatal crashes are we having here?
I do not, through the chair, I do not have that data in front of me for, depending on kind of what time span you're interested in. Happy to help provide that. This map this pulls from 2015 to 2019 data. Sorry, it pulls from 2016 to 2020 data. This is from the Vision Zero Action Plan, and it touches on the rate per 10,000 jobs and people, and the rate of the number of serious injury crashes. So it's hard to parse exactly the number of crashes that happen in each ward from this, but is meant to kind of demonstrate.
Would green then signify that it's the worst?
That's right.
The dark
yes,
green?
Through the chair, yes.
And the light tan signifies you have not too many accidents.
Through the chair, yes.
All right, so when we look at the top corner here, yellow is like maybe a cautionary signal, then that brown, greenish, which looks like that's Ward 9 sits in, is the next level of seriousness, and then the dark green. Looking at these patterns, Mr. Chairman, to the distinguished lady, what does that tell you when you look at this and you're extrapolating this information? It tells me something, but I'm not sure what it tells you.
Yes, through the chair, we certainly see the most number of fatal and serious injury crashes on the east side of Cleveland. And if I may also bring up this other map, which shows car ownership rates. It
shows who?
Car ownership rates.
Okay.
It really overlays the two. So it tells us, I think access to a personal vehicle, and then the rate of time someone is hit by a driver. These are related, kinds of variables.
So why would it on the east side that you would have some of your highest accident incidents, and then are you saying to me that these purple locations that we see on the map are locations where people just don't have no vehicles?
Through the chair, that's correct.
And
yeah.
why would that be the case?
So in terms of vehicle availability through the chair, certainly income disparities is I imagine one of the driving factors. And then in terms of safety, I think it's a combination of the way the streets were designed and neglected to be designed for people and not just cars. yeah, especially in the east side. And then also the combination of you have more people who are traveling outside of a vehicle, walking, using transit, riding bicycles in those areas, which means we're seeing higher numbers of people being hit by drivers.
I would suggest, I'm not going to go deep into this, but I would suggest that, with your component of ask, that one of the things that is really significant and important, and you brought this out when you talked about all of the speed bumps. Which street did you say it was on? Because I'm going to go over and take a look.
Through the chair on Waterloo.
Waterloo. So in that geographical zone, there's a whole lot of street tables over there to slow the traffic down. We don't have that on the east side of the city of Cleveland. And as you can see the numbers and you can see how the colors change, that would also probably attest to the lack of police code enforcement. Also, it would tell you too that there's no financial investments in these neighborhoods. So you have a situation of no services from the city of Cleveland in terms of traffic code enforcement, no services in the city of Cleveland as relates to directing and targeting finances to go in those zones to improve the quality of life of those people. So when you started thinking about, and I just want you to keep this in mind, because I saw some of the people who are in my neighborhood, Mrs. Lattimore, it was good to see her face in your slides, and then others who were very participate. I would just caution you when you get ready to put it all together in terms of your ask, safety has to be that component. And cities have a responsibility, and our city has a big responsibility, is not just protecting some parts of the city of Cleveland, but we have the responsibility of protecting all parts of the city of Cleveland. So in this, I would say that you think about, how we get code enforcement intertwined in this. We will not be able to stop all the craziness that's going on. And as we look at your testimony here, we're not even talking about people on bicycles getting hit. We're talking about people just walking the street getting popped. And the reason being is because I don't know, it just seems like we're in a different day and time, because it seems like no one really cares about how they drive today. And it doesn't matter to some degree where you go. I know that you can feel that. I can feel the impact everywhere I drive now. Drivers are absolutely lost their minds, some of them. And so when you do think about this in terms of your overall plan, you can't leave that dimension of traffic enforcement out of this, because none of this will fundamentally work. And what you're suggesting, at least in my mind, will be a great deal of economic investment in order to get to a space and a state where we would truly have safer streets in our urban cores. And so with that being said, I'd love to meet with you after. I don't want to spend too much more of your time on this, but there's a lot of other factors that you have to take in consideration when you talk about bike paths and when you talk about bike trails and how those trails interconnect into the city. And you have to also think about economics too, because if you curtail too much traffic in some zones, you kill the neighborhood. Like someone had a bright idea on Euclid Avenue to put a bus line down there. Well, they killed the entire Euclid Avenue. They destroyed it. They didn't even think about it when it was brought up at the time that putting such a bus route will kill all of Euclid Avenue. It's still dead. It still has not come back to life. So when we think about these plans on a global perspective, we have to also keep in mind how we make the decisions and how it may potentially impact a neighborhood or community. With that, thank you, Mr. Chairman.
Thank you, Councilman Jones. Absolutely. Councilman Shaw.
Hey, good morning. Thank you for your presence. Thank you for your time, Chair, and thank you for your time, Ms. Thomas. I appreciate it. I always have talked about how part of the reason why I live where I live is because I wanted to be in close proximity to the Red Line and be able to take ride my bike. It's to me one of the greatest things about living in a city is that we don't have to take the car everywhere. Otherwise, I'd go live in the suburbs. So I really appreciate the advocacy that Bike Cleveland does on behalf of riders of all ages and sizes. I just wanted to talk a little bit about money. I think at the end of the day, so much of how we want to fund things and our limitations come back to money. My understanding is that, I'll let you answer. In terms of how much this costs, how much of that is a barrier to this being implemented in your advocacy that you've seen?
Good question. Through the chair, in my experience with what we're seeing right now, I do think it's more of a capacity to install than necessarily a capacity to pay for it. The city's mobility team has done a really great job of securing funds for these projects. And then some of these projects are full capital projects like the roundabouts on Franklin, and some of them are those short term or those quick build, easy to install things like curb extensions, centerline hardening, and things like that. And so this council recently approved the capital improvement plan, which included a recurring amount of funds for both Cleveland Moves and Vision Zero, and we can get we can really get somewhere with those funds. But in my experience, I think those things are delayed by staff capacity. And then certainly, these projects are very expensive. And I think that building portions of these budgets for major capital projects into safety enhancements. Something I think about through the chair is like the cost of things like redecking a highway or even, utility work, the general reconstruction of a street. Those costs are much, much higher than what we're talking about when we talk about adding separation to existing bike lanes, doing curb extensions and centerline hardening. I think it's just how we decide we want to invest, and also severely limited by the state and how the state funds these things. But I do think, given that we do have money right now, and all of the work that staff has done to secure those funds, it's really about figuring out how to get it on the ground faster.
That's helpful. I think grant funding is always hard to depend on for staffing purposes, but as especially members of municipal services and properties think about how separate revenue generation potential, such as parking legislation that we're discussing, how that revenue could be used for staffing upgrades for this type of work. And I'm really hoping that we as a council talk and think through more of how that additional revenue can be used in creative ways to fund these different ways of actually structuring our streets. Because to me, I think, of course, a health issue. Traffic calming is also a public safety issue. We saw the number of crashes. All of these things are things that we can make a concrete difference on immediately. So to me, it's a really important. Go ahead. Did you want to add anything?
Yes. Through the chair, I wanted to say too that local funds are always easier to access and deploy. When we are relying on a federal grant, we're talking about many years before we're actually seeing that infrastructure on the ground. And so when the city is able to increase its capacity to support this kind of infrastructure through local funding, it definitely increases the speed of deployment. And so I think, yes, like parking revenue, that seems like a natural kind of place for these funds to go, because the way that we've taken our public streets and given much of that space to people's private vehicles, where that money goes could be to making it easier for people to choose the other options of walking, biking, transit.
Absolutely. My final question is regarding the CMAQ funding that we just recently passed, I think, through the Utilities Committee. I think it's still waiting on DPS. I know one of the questions that was raised, and this touches on Berea and my ward as well, that's one of the roads that's being considered, for additional upgrades for the biking lanes. One of the concerns that I know Councilman Casey had was how Berea also has a lot of heavy industrial traffic as well, and how to kind of balance the need for industrial traffic needs versus biking infrastructure. It's not always a great match, but wanted to hear if you had any thoughts about that, or kind of what you've seen in your experience that can help bridge that.
Through the chair, I ride Berea all the time in its existing condition, and I think that with these kinds of projects, there are going to be a lot of questions on the front end, and these are all kind of in very early stages of conceptual, design and not anything detailed. And so I think a lot of those concerns can be sorted out through the design process. Berea would certainly not be the first street. And there's lessons to be learned from other cities about how they balance those things and ensure safety for everyone and access. And then I think streets like Berea, there's frequently analysis of like how many curb cuts there are, like where are the access points? Is there a side of the street that there are fewer of those access points needed? Like in the case of Berea, there's long continuous stretches where no one is turning. And so I think a lot of those concerns could be addressed through those that kind of detailed design work. Yes.
Thank
Thanks
you.
for your question.
Yeah, of course. Thank you, Chair.
Beautiful. Thank you, Councilman Shaw. Councilwoman House Jones.
Good morning. Thank you through the chair to Ms. Thomas, Director Thomas. Really wanted just to follow up the conversations regarding, I guess, the lack of citations and going through the criminal justice process. Have you all done any analysis as to what happened, why citations were very low, non-existent? Can you explain more about that?
Sure. Through the chair, I wanted to say first, I have kind of started a surface level analysis of this, and it's something that I'm going to dig deeper into as we complete the crash report, and I'd be very interested in coming back to talk more about this. But based on that initial analysis, it seems that there is an attitude that crashes like these are an insurance problem. This is something we've heard from body camera footage that we've collected, that frequently it is just the attitude that these things are sorted out in insurance and not through citations and tickets. I'm not sure exactly why that is, but it's something that I hear a lot.
Follow up through the chair. Do we have laws and city ordinances on the books that would require a citation or moving through the criminal justice system?
Through the chair, I don't know that there is. I mean, there is code that clearly delineates what should be enforced and like what is breaking the law, like when you're striking a person using a crosswalk. But I don't really know of what mechanisms there are to like kind of standardize when the citations are written. And I think anecdotally, the way enforcement happens for pedestrians and bicyclists especially is for there to be a ticket, the pedestrian has to have been behaving perfectly. And even then, there's not always tickets. But for example, there was a crash at East 140th and Kinsman where a woman was crossing the street and a driver turned left and struck and killed her. And she hadn't pushed the button. Even though it was her turn to cross, she hadn't pushed the button, and so it said "Don't walk," and because of that, she was labeled at fault for that crash. And so, even if it is their turn to cross, if it is a button-activated walk signal and it says "Don't walk," they say the pedestrian was at fault. I also think there's kind of a misunderstanding about bicyclist laws. For example, I see instances where the bicyclist was at fault for not crossing in a crosswalk, but that is not required. I mean, I ride on the street. I'm using turning lanes to turn at any intersection. And so I think there's a misunderstanding. And we are currently working with the Ohio Department of Public Safety and ODOT to create first responder trainings to address some of those misunderstandings.
Okay, yes, through the chair, following up on that, even with that, what does the law, again, and this is going back to the fundamentals of what is written. Does the law say you have to push a button? That's the thing is like what I'm trying to understand is does the law state that you have to push the button, and if it says don't walk, you don't walk, depending on the light and color of the traffic light.
I think that there's kind of a conflicting, through the chair, kind of a conflicting way to interpret this because, for example, there is a law that says, a pedestrian cannot cross on a don't walk sign, but there's also laws that say that drivers must yield to pedestrians in a crosswalk, and I think that there's a basic expectation that a person watches where they're going, and even if a pedestrian, a person walking, is maybe not behaving perfectly, there should be no trust that everyone is paying attention and that you can make those mistakes and no one has to die. But ultimately, when you talk to some people, they will kind of lean into that pedestrian has the right of way. There's a requirement to yield, but then there are also laws that you're able to kind of justify these things by because they say you cannot walk without a walk signal, and things like that.
Well, the reason why I'm bringing this up is just I actually, the first time yesterday, actually walked somewhere in my neighborhood to an event, and I realized very quickly some intersections have nothing. There's nothing, and far too many of our intersections don't have anything. And so I would advise or just offer to this committee, to begin to look at what do our laws actually say. And I am really, 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 I think there's an opportunity for us to look at what our written ordinances are, and on top of that, to really clear, and this is my final question through the chair, do we have, and I'm saying from a public safety standpoint in our criminal justice system, do we have a kind of data analysis as it relates to traffic incident, vehicle, pedestrian, vehicle, bike incidents that are publicly available?
So through the chair, that is something I'm currently working on. It is a tedious process where, yes, we did not do a ticket analysis in our last year's crash report. But for 2025, I am looking at every single time where we have an OH1. We have to have a police report to be able to do this analysis to see when there was if there was a ticket issued, what was the outcome of that ticket, and so it's taking a bit of time, but happy to share that information once we have it.
So I would just put a clarification. I'm saying from the public sector, does the city of Cleveland have a data system, a publicly available data system that readily shares this information?
Through the chair, no, not that I know of.
Right, and I'm being very clear on the reason why I'm asking this, as we will be approaching the safety committee about increasing some penalties. I think this highlights specifically of how there are disconnects as it relates to publicly reporting data, especially from the entities that are issuing tickets, going through court process. These things need to be available for people, and they are not. And so just thank you so much today for sharing this information.
Thank you.
Thank you, Councilwoman House Jones. Councilwoman Nikki Hudson, I'll just share, we have about 20 minutes of our caucus. But
Okay, thank you. Through the chair, thank you for your presentation. I just want to add that the information you just shared makes me want to have the buttons removed so that that the walk light appears automatically, because I don't want the onus to be on pedestrians to make the signals change, because that seems like a ridiculous way to blame the victim. My question is related to education for the public, related to traffic calming and things like roundabouts. And who has the responsibility of educating the public on how to navigate these, like the mini roundabouts or even the large roundabouts at like near Steelyard? And do you know if the city or the Division of Traffic Engineering reaches out to the folks on the streets where they're installing things like delineators or center line hardening aspects on various streets?
Through the chair, to your first question about, educating people on how to use this infrastructure, it is a challenging question, and something I hear very frequently is kind of an overall, I think that our driver education system is flawed. And there are not many requirements to know how to navigate specific types of infrastructure. I think that we certainly try to do work, especially in advocating youth on riding and using those types of infrastructure, but I don't know of much work happening on the driver side, except for some one-off classes that some of our partners do. And then to your question about kind of city communication. I don't think I have a total complete picture of it, but I know, like, for example, there are attempts to put signage out explaining what the change is, alerting people when they are going to get a speed table on their street that there's going to be a change. But in terms of like navigating things like roundabouts, which we might see more of, I'm not sure what exactly is happening on that end.
No, thank you for that, and I think that probably also speaks to the staff capacity at the city and the need for a Department of Transportation, so that we can add that and make sure that the drivers are educated. I appreciate your efforts to educate riders, but really we need to educate drivers on how to navigate our roads safely and to keep pedestrians and cyclists safe. That is all. Thank you.
Thank you.
You know what? And then we'll yield to Director Margolius, because we have to move forward. Councilwoman, that's a great idea. 'Cause, you could implement legislation, you could pass legislation. We'll take a look at that. However, it should be overlapping with education. I don't care if the education is in the public schools, whatever. We figure out how to educate, and we might even could put a campaign on to educate. But you tell us your thoughts, and then we could reach out to the CMSD or the different schools or the key stakeholders that can help us to educate people. We can do that as this council when you meet with us, when Austin Davis bring you in to meet with us. So put that part in there, the education part. Thank you, Councilwoman. That's a great idea.
And to the chair, just a last thought, something that I've thought about before is how we're integrating the education into the justice piece, and when people receive traffic citations, like, are there resources they're able to get that, describe exactly why this type of driving is so detrimental to people's, livelihoods and our community. So just a thought.
And we could reach out to the municipal side of the OWL, and when people receive citations, as well as you mentioned earlier, Case Western Reserve University or UCI, we could have their police department, if you tell us what we need to do, because you're the expert. What Councilwoman narrated to us, we can have that in the educational part of it. But you have to tell us, because I don't know. I want to know, but I don't know everything. But we can help champion it.
Yeah, you know plenty.
Yeah. But I don't know about the bicycle piece part.
Right.
But I need to listen and learn, and we can champion it for the outcome measures. So whenever you reach out to Councilmember Austin Davis, we'll move forward with that. And that would be a great outcome measure. Thank you.
Thank you
Thomas.
to the
Thank
chair.
you.
Thank you all of the council
Thank
members.
you.
Thanks for having me.
You did
So much to
great.
think about.
You did great,
Yeah.
young lady. Director.
Did you see those pictures of the people getting hit?
Yeah, I like what Councilwoman brought up, Nikki. minute, but you gotta move it forward and you have to manage it. And education is cool beans.
Morning.
Okay, so let's move. Good morning, good morning.
Good morning. Good
everyone.
morning. Thank you.
I know everyone at the table except this young lady here.
Dean Jackson Gross, I'm the Director of Nursing.
Oh, Director of Nursing. Okay, okay. Great to meet you. Great to meet you. And Francis, you will get in touch with me about the other piece. We'll do that. I should have your number, and I'll give it to Imani, and we'll call. So we'll do that. Okay? If you don't hear from me by Tuesday, then reach out to me. Today or Mondays, you know, it's very busy for a council member. But Tuesday, we can do that if you don't hear from me. Thank you. Okay, Director, ordinance number 585, 2026, by council members Conwell and Griffin, by departmental request. It's an emergency ordinance authorizing the Director of Public Health to enter into one or more contracts with Ohio Public Health Association to provide temporary staffing of registered environmental health specialists for the Division of Environment, Department of Public Health, for a period up to 1 year, with one option to renew for an additional period of 1 year, exercisable by the Director of Public Health. Ordinance number 5852026 have been approved. It was approved on May 12th by the Department of Health, you Director, as well as the Finance Director and the Law Director. Sir?
Thank you. To my right is Dr. Commissioner Wallace Chambers, who can answer any questions, but this is a relationship we've developed with the Ohio Public Health Association that allows us to hire some part-time health inspectors to supplement our work during the busy times of the year.
Commissioner, can you narrate it to us?
Oh, sorry. So basically, there was a time when I started in 2024. We had a lot of new staff. We had 8 new staff. We have a bunch of staff that has less than 3 years of experience. So,
Put you down? All right.
so what we did was we found out that they couldn't do the inspections because they were fairly new and they had to go through training. So one of my ideas was to do a pilot project and use those folks from Ohio Public Health Association to hire them to help us temporarily to get us caught up while we're training our current staff.
And so, did they give you any training material?
No, we provide the training. They provide the contractors. We provide the training. But the people we hired were ex-employees of health departments that they contract with. They have to have their registered environmental health specialist certification.
Let me process real quick.
So basically, the contractors that work for OPHA were previously health department staff. So they did the work, basically.
They knew the way.
Yes. They're not new people off the street. They're people who've done the work.
Experts.
Yes.
Okay, okay. Councilman Joe Jones.
Thank you, Mr. Chairman. This is concerning legislation 585-2026.
Sir, yes.
Yes.
Yes, sir.
And the contract amount does not exceed $100,000.
Through the chair, that's correct.
And, Mr. Chairman, this is coming out of the Environmental General Fund,
Through the chair, correct.
and this is hiring one person.
Through the chair, last time we did this arrangement, we had 2 different part-time folks who were working with us, and so we'll see who they have available this time once we go into contract.
And these two,
And then Councilman through the chair, through the chair.
and these two contractors that are part-time people, Mr. Chairman, to the director is to inspect and incorporate code enforcement of food service operations, and to inspect and incorporate code enforcement in public swimming pools, spas, and special use pools, prepare records and report related inspection activities throughout, I presume, the field of the health space, HDI
Director.
Through the chair, we have somewhere between 12 and 15.
Through the chair, we currently have 16 and 1 we have that we're currently hiring, so 17 total, not counting management.
Sir?
So we have a total of 17 inspectors that do this work throughout the entire city of Cleveland?
Yes.
All right, and of those 17 total inspectors, how many of those 17 inspectors are part-time?
They're all full-time. Through the chair, they're all full-time.
Do we have any part-time inspectors?
Through the chair, no.
So these would be the first 2 part-time inspectors?
Well, they're contract. We may or may not need them. The goal is not to use them.
I see. And Mr. Chairman, one of the things we hardly ever talk about here at this table is, you know, what is the load of our inspectors? So
Workload.
that's correct.
Okay.
So, Mr. Chairman, what is, you know, when we start talking about our 17 full-time inspectors plus the possibility of bringing on, and the reasons why we're here is that you do need to bring on additional assistance and help. So the question is, you know, how many food service operations and establishments that we inspect on an annual basis? Mr. Chairman, this is a public request for information. So the issue would be how many food establishments do we expect? And what is our whole scope, Mr. Chairman, of services that these 17 total inspectors provide the city of Cleveland? Do we know that? Can we talk a little bit about that?
Through the chair,
Mr. Chairman? And do we, Mr. Chairman, do we have some information that the director might be able to provide for us so we can have a better grasp and understanding of what the request is here as well as what the workload is?
Doctor.
Through the chair, again, I want to stress that this is just a safety net. This is not people that we need right now. This was only brought up as a safety
Mr. Chairman,
net.
I understand. And so, Mr. Chairman, to the distinguished gentleman, you know, I do understand that, but sitting here at the end of this table here, and given the fact that I have a lot of issues and problems in my neighborhood, I would like to have the requested information, Mr. Chairman, that I'm asking for, so it gives me a better ideal and concept of what is the workload of our 17 people here, and are we getting through that workload? Is it a manageable workload? Are we meeting the goals and expectations that we need to meet? And none of that can be totally, you know, answered right here. We would actually have to have, Mr. Chairman, the data. So can we make that available, Mr. Chairman, to the director?
Through the chair, absolutely. Yep.
And then you could reach out to, you guys can talk with the councilman. You're looking for contingencies.
Yes, this is just a contingency plan. With our current staff, we are able to get through our workload.
And so, Mr. Chairman, can you give me some ideas then, at least preliminary, how many inspections that we have to make a month or a year on an annual basis with the 17 people?
So what our guideline is, through the chair, I'm sorry, what our guideline is, do 4 inspections per day. And that's very manageable.
And so, Doctor, you could reach out and talk with Councilmember Joe Jones. The legislation is on if you need it
Yes.
for training or whatever the case may be. What you want to do is have a contingency there. You can reach out and you can get what you need on a contingency basis.
Through the chair, yes. Just in case we have some staffing needs, that's all this for. Our current staffing levels, we're able to get through our workload.
Right, which is good to have. And so if you and the council member, I know I took a minute of your time, Councilman, but we have 11 a.m. coming up.
Well, no, I just asked a question that, you know, the gentleman said that he makes 4 inspections a day plus the 17, so I would presume that there's 3,536 inspections that are being done throughout the entire city of Cleveland on an annual basis, based on those numbers. And that's the reason why I asked what was your monthly, and so I wouldn't have to put these numbers together. What was your monthly?
So
and what's your
roughly there's
annual?
about 3,100 licensed food establishments in the city of Cleveland. And that's just for food program. We also do swimming pools as well.
You do?
Yes.
And it'd be great, and I thank you, Mr. Chairman, because I know time is of essence. I will meet with the gentleman after. Thank you.
Thank you. And then reach out to Councilmember Joe Jones for me, and you guys can talk, and you can visit his ward, and they actually have a huge meeting. All right, saying that, Councilmember Shaw.
Thank you for your time. Just a quick question. Our public health inspectors, the ones that we have on staff or the temporary ones that this would give you the authority for, I'm just wondering, what is the language accessibility? Is that, do we have bilingual inspectors? How do they address that when we have establishments where the operators may not necessarily speak English as fluently or at all?
Yeah, through the chair, that all city employees have access to the language line. We do have a diverse group of folks, and some have some second and third languages, but there's always more languages than what we've got in terms of staff, so language line.
I see. So, through the chair to the director, so just kind of walk me through like what that would look. So if they show up somewhere and the operator or whoever is their manager is not proficient or fluent in English, they would call, or is there someone in person who comes?
Through the chair, yes, that could be one way. I think if more practically, and Commissioner Chambers can comment on that, is the restaurant operators bring in someone who does speak English on their team. But the opportunity with the phone is always available for folks.
Yes, through the chair, most of the time they have somebody on staff that can speak English, but they do have the opportunity to use their language line.
Okay. Have we, and not to doubt any of the inspectors' work or their capabilities, but rather I want to make sure that our operators and small business owners actually have the comprehension and not just a checklist of like what they need to do long term. Especially, I think this is more prevalent amongst ethnic establishments where it may not have that same level of correlation. So, in your experience, have you gotten feedback from operators or establishment owners about not potentially understanding the full scope of what they are required to do or what they should be doing
Through the
because
chair,
of a language barrier?
every food service operator has to have a person in charge that has gone through a course mandated by the state.
Is that serve safe?
Yeah, well, it could be serve safe. That's one of the options, and so unfortunately there is some proficiency that they have to prove outside of our own inspections, and our inspections just prove that they've done the course.
Okay, I see.
Yeah.
That's all the questions I had. Thank you.
But through the chair, though, I do want to say we do work with other agencies, and they assist as well.
Okay, that's great. Thank you, Chair.
Any more questions on ordinance number 585?
Yep.
Councilwoman?
Thank you. Through the chair to the team here. I just have a very quick initial to get your opinion on, because this is something specifically because we're talking about licensing of food establishments, correct? I mean, and having supplementals for that. One of the things I have been researching is an excess litter fee. This is something that is done in other municipalities, specifically to help a municipality develop a system to actually clean up the trash. Our city is very, in some locations, are just very dirty, and people unfortunately use our streets like a garbage can, and they need to actually, at this point, it is enough with the talking. We need to begin to penalize people, which this fee will automatically probably rolled over to the consumer. But when you look at the paper, it's food paper, it's bottles, it's you name it, a lot of times. You know what I'm saying? Mixed with other things. And so I guess that my question is, has the team actually thought about it? Have you heard of things of this nature? And do you have any initial thoughts, as me and another colleague have, I've talked to another colleague, but this is something at this point I really believe that we just need to begin to explore so that we can build our capacity to have the personnel here within the city of Cleveland to clean up the city of Cleveland.
Sir, Director?
Through the chair, I think about it all the time when I'm on my way, back and forth from home to work, and I am behind someone and see them just open the door and drop trash, and I'm powerless to do anything about it. And so I just am grateful for your effort and open to ideas.
All right, well, stay tuned because by the end of the summer, we're really working to introduce the legislation.
Great.
Through the chair, I just want to offer that we do, when we go to certain establishments, we always advise them to put up cameras, but some of them for some reason don't, because we need to get these people on license plates, get the evidence so we can hold them accountable. But a lot of times people dump and nobody knows who did it.
Yep. You know what, Councilwoman? I was headed to Legina Ray's event yesterday on East 89th Street, Way Park. A car in front of me pulled to the stop sign, took garbage, and just threw it out.
Yep.
And I'm powerless like you, Director.
Yep.
But I wanted to do something else, but I can't do it. I have to use emotional intelligence, you know?
Right.
Yeah.
And I would say with this, and this is because we know this is individuals' behaviors, there has to be a level of consequences. Because many times what will happen is people will be charged, not at that moment, but you're charged in advance, and at least we will have the personnel to actually be able to call people to clean things up, and people are going to have to pay for it. You know, I think we are far beyond the thing of education. People know that this behavior is wrong, and because they continue to do it, unfortunately, people are going to deal with the financial repercussions of their bad behavior. That's just my suggestion in the immediacy, because people are just not treating our communities the way they need to.
No, they're not. And you know what, Councilwoman, when they drive through University Circle, when they drive through Bracknell, the behavior change. They don't speed. You don't need speed tables in University Circle. You don't need speed tables in Bracknell. They don't throw trash out. What I can see, when I pass through there, they change their behavior. It's behavior. So we need a red hot stove effects. Thank you very much. Saying that, ordinance number 585-2026 stands approved. Sir, batter up. Now, ordinance number 592-2026 by Council Members Conwell and Griffin by departmental request. It's an emergency ordinance authorizing the Director of Public Health to apply for and accept a grant from the Ohio Department of Health for the Title X program, authorizing the Director to charge and accept fees, entering into one or more agreements to receive payments from Medicare, Medicaid, Medicaid HMOs, and other third-party insurers, and authorizing contracts with various entities, requirement contracts, professional services, and advertising contracts necessary to implement the grant. 592-2026 have been approved by the Public Health Department, the Finance Department, as well as the Law Department. Director?
Through the chair, thank you. This is our biannual legislation authorizing us to accept and spend money from the Ohio Department of Health for our clinical services. With me to my left is Dr. Jeannie Brooks Johnson, Director of Nursing and nurse practitioner, and Commissioner Francis Mills, and we're here to answer any questions about the legislation.
With this, I'll put you down, With Medicaid, and they're making cuts, how do you think this will affect us? Or even if you want to go in the outer scope to talk about how it's going to how it's going to affect the city, you're welcome, Doctor.
Sorry, through the chair, it'll affect our possibly our program income for our grant, but it will not affect the services that they receive. We don't turn anybody away based on their inability to pay, so the services will continue they'll still be able to get the services, and we do have a clinical billing specialist that will help. She's like a navigator. She will help them get into other sources of health insurance. So she's a certified application counselor. So we will patch the patients through to her so she can, help get them through. We bring up the bill, but we care more about their health.
So if we have a shortfall, where do we get the dollars from? Us in the city, from the general fund, or do we write a proposal to receive grant dollars, or you send them to other healthcare providers?
We can refer them, but primarily we get the grant. We bill the patients. 49% of our patients have insurance, so we bill that 49%, and then the grant helps us offer care for the patients who are uninsured. So we cover them with the grant funds, the services that we render. And we get 340B pricing, which is, it's set up for patients who are underserved, so we get a substantially different, lower cost.
So have you made an assumption how it's going to affect us or affect the budget or affect the patient in the long
It
run?
won't affect the patient in the long run. I think that could have a little bit of impact on the budget if we're not being able to go and charge like Medicaid for those services. But I know that that's what the Title X grant, it's set up to catch those shortfalls. That's the whole, instead of let people, go out there without care, we don't, like I said, we just render care for patients where, regardless of what they have, but their insurance. But it has been enough to treat them appropriately. We have never turned anybody away because we can't afford it. So
Right, we want to do that.
yeah,
So you think, I'm going to do an assumption. The Medicaid cuts will be when? Do you know?
I don't know. I don't have that.
But we know it's coming.
Through the chair, they've already started just in increasing the bureaucratic burden on having folks reapply every 6 months. And so that's part of the strategy for them to disenroll more and more folks off Medicaid. So it's already begun.
So I'm sorry, what was that again, Mr. Chairman? He said, I couldn't hear you. Mr. Chairman, the Director of Health?
The work to cut folks off of Medicaid has already begun, with the state and many states requiring folks to re-enroll in Medicaid every 6 months, which is just creating more and more bureaucratic burden so that it discourages people from having Medicaid and coverage, and that's already begun.
Yeah, that's what they want to do. The redeterms,
Is that-
redetermination, redeterms.
Mr. Chairman, is that based upon the state?
Through the chair, it's
Because
the
sometimes
federal
it's
and the
different
state.
levels of it.
Yes.
So is the state government making those requirements, or is it the federal
Federal.
government
Through
in
the chair,
addition to
both the state and the federal government
Is it
are
both of
are
them
causing challenges.
intertwined? Okay.
My assumption is that
Can we bring them in here, Mr. Chairman? Have the state people come down here, tell us why they're doing that.
either we can visit them or they
We
will
can
come
subpoena
in.
them here, Mr. Chairman. We can use our subpoena power.
Well, I don't know about the
Subpoena them to
feds.
come here and tell the citizens why they're cutting them and doing all this nonsense.
Well, let's take a look
I
and
mean,
see.
we might as well go ahead and grab the bull by the horn and bring him down, or else we're going to have to deal with it another way.
Well, they're cutting, council member, a lot of things. The SNAP program, the Medicaid. It's part of the big, beautiful bill.
Well, let them come
So
in
they
and
make
explain their
cuts.
beautiful bill to the people, so that we won't wear that jacket.
Well, we could do some things right now this year, Mr.
You know, of
Council
course,
member.
the people want to see
We
the
as
Democrats
council
fight
members.
back. So bring the big, beautiful, bad guys to the table so they can explain their big, beautiful, bad program and how it's having a negative impact on our beautiful city of Cleveland. And I
Okay.
think at the end of the day, I think that's really important, Mr. Chairman, is that we can't sit here and talk about what's happening across the hall. Bring them in the table. That's the reason why we got the subpoena power. Make them come, compel them to come to the table. And I'm quite sure the majority of my council colleagues here agree. We're all Democrats. We shouldn't have to suffer. We pay a lot of money as the city of
Us being
Cleveland.
all Democrats, then we
And
got to
and we are an engine here. We put a lot of money into
not
the state
going.
of Ohio's programs, Mr. Chairman, and they should be able to come in and explain to us why they're
Joe
doing
Jones,
that.
I yield to you.
I know. I just wanted to know what can we do. That's all.
I yield to you, Councilman Joe Jones. You next anyway.
I don't want any. I don't
You
think anything.
next. You next, Councilman. Yes, Councilman.
Mr. Chair, I move to call the question.
We can't bring them to the table right
No, we vote on the legislation.
We're
It's
just
we're going to vote on the legislation.
we're gonna agree to it.
I called the question, he seconded it, call for the vote.
All right, call for the vote. Yes.
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 All right, so we can go. Ordinance number 592, 2026. You a trip, man. I mean, sorry, let me take this up. And stands approved. All right, thank you. Now we can make it to our thing.
We just want you to bring them in here, Mr. Chairman.
We got caucus together into the hall.
Yeah, we do.
I am all brushed up.